Hello, my name is Rosemarie. I'm a student nurse practitioner and I'm going to be performing a physical exam on you today. I've already washed my hands, so we're going to start by inspecting your head and skull. So we're feeling for contour, that there's no depressions, that it's symmetrical. We can see that the size is appropriate for your age. Your hair is evenly distributed, no areas of baldness. There are no scales or lesions on the scalp, and the hair is fine texture. Your face is symmetrical, no lesions, scars, hirsutism, edema. Your eyebrows and eyelashes are symmetrical with appropriate hair growth. Your eyelids do not droop over your eyes. Your sclera is white. Your irises are brown in both eyes. I'm going to check your temporal arteries. Just tell me if you feel any tenderness.
No.
No, and they're at a 2+. Was there any tenderness on the scalp while I was touching?
No.
I'm going to check your conjunctiva, so I'm just going to lift up your eyes. Good, and I'm going to do the lower part. Good, they're both pink and moist. Your medial and lateral acanthuses are also moist with no excessive tear production. We're going to move on to testing your eyes. So I'm going to shine this light directly in your eyes, check your pupils. Good. And as I was looking at one eye, I was also looking at the opposite eye. Your pupils are 3 and they do constrict. They're equal, round, and reactive to light. I'm going to perform an optic test. For the purpose of time, I'm only going to look in one eye. I'm going to place my hand on your forehead. I'm going to come with my left eye to your left eye, come at a side angle until we get in. So we're looking for the red light reflex. We're looking to see your retinal vessels, your optic disc, your disc to cup ratio, and your macula. There are no scratches on the cornea. Everything looks good. We're going to test your eyes for accommodation and convergence. So just follow my finger with your eyes. Don't move your head. Looking to see that your pupils constrict when they get close and dilate as we come out, and your eyes move appropriately. We're going to check your extraocular eye movement. So just again, keep following my finger. Good. No nystagmus. Awesome. We're going to check your peripheral vision. So just let me know when you see my fingers wiggling.
No. No.
Yeah. Good. We're going to move on to your nose and mouth. Your lips are pink and moist. We're gonna look inside your mouth. You have all your teeth. Good, open. Mucomucosa are pink and moist. Palates are pink and moist. Under the tongue is nice and blue. Tongue is not swollen. No lesions. No edema. Say pupils. Tonsils are on +1 with no exudates or erythema. I'm going to palpate your frontal and maxillary sinuses. Tell me if you feel any tenderness.
No.
Good. Palpate your nose. Any tenderness? Good. We're gonna test one nostril for now because of time. Good. Tell me what you smell.
Alcohol.
Good. And we test the patency by occluding one side. I'm gonna take a look inside your nose. We're gonna do again one nostril. We're looking to see for deviation, perforation. Mucomucosa is pink. There's no swelling, no polyps. Awesome. Next, we're going to move on to your ears. You can see that your ears are symmetrical. I see no lesions. I'm palpating mastoid process. Any tenderness? Any tenderness in the auricles? No, I feel no lesions in the back. We're going to start with a whisper test. I'm going to do one side. I'm just going to whisper some words, repeat them back.
1, 2, 3. ABC.
Good. I'm going to take a look inside your ears now. So we're looking for the tympanic membrane to see that it's pearly. I'm just going to pull on the auricle up and backward, and I'm going to insert the speculum down and forward. We're looking to see the cone of light. On the left side, it should be 7 o'clock. On the right side, it should be 5 o'clock. There's no perforations. Good. Oh, I'm so sorry. Next, we're going to perform the Weber and Rhine test, which tests for hearing loss. So I'm just going to strike the tuning fork, place it on the top of your head, and you're going to let me know if you hear it equally in both ears. Is it equal in both ears? Yeah. Okay. It's okay. I'm going to perform the Rhine test. I'm going to strike the tuning fork, place it on the bone on the back of your ear. I'm going to time it, and then I'm going to move it next to your ear. You're going to tell me each time when you stop hearing it. Normally, you should hear it longer when it's off of your ear and next to it. We're going to keep an eye with the clock. So just let me know when you stop hearing.
No.
Good. And then tell me once again when you stop hearing. so we see that air conduction is longer than bone conduction, which is what we want, and that's good. Next, I'm going to take a look at your neck. Your neck is symmetrical, there's no masses or lesions. I'm going to palpate all of your lymph nodes. So you just tell me if you feel any tenderness. The preauricular, postauricular, occipital, tonsillar, submandibular, submental. You have 3 along your cervical chain. You have a deep, you have a posterior, and a superficial. Those are generally harder to feel. And your supraclavicular. If your your lymph nodes are palpable or tender, that could be a sign of infection. I'm going to palpate your trachea, see if it's midline and not deviated, which it is. I'm going to stand behind you and go for your thyroid. We're just going to see if it's symmetrical, swollen, or if there's any nodules. You can just swallow for me. Good. It moves up and down symmetrically, which is perfect. Okay, so we're going to move on to the chest. Now with the chest, normally I'd have you take your shirt off, but we're being videoed, so we're not going to do that. So we look at the skin and we look for any masses, any lesions. We watch your rate of respiration, which should be 12 to 20 breaths a minute. We look for retractions and bulging. I can see that your AP diameter is 1 to 2. I'm going to check for chest expansion, so just take a breath in and out, and my hands move up and down symmetrically. I'm just going to palpate for any masses, which we don't feel anything. I'm going to percuss in all the lung fields. Now normally we get a nice resonant sound. You have to make sure you're in the interspaces of the ribs, and should just keep moving in a ladder position all the way across. Next, we're going to listen in all the lung fields. When I place my stethoscope down, you're just going to take a deep breath in and out. And we keep this ladder motion. So at the top up here, we should have bronchovesicular breath sounds. So far, clear and present in all lobes. As we come down to the bottom, we get vesicular breath sounds that are clear and present so far in all of your lobes. Good. We can do tactile fremitus. So I'm just going to place my hands on your chest and have you say 99.
99, 99, 99, 99, 99.
Good. That checks for consolidation. I can feel the fremitus. So now in the back again, we would do the entire inspection, palpation, check for the masses, check the skin, check for bulging. We would do the chest expansion. We would do the percussing in all of the lobes. We would do the auscultating in all of the lobes. But because of time, we're going to cut all that short. I'm going to do a test called egophony. So I'm going to have you just say E as I place the stethoscope down on your back.
E, 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 E.
Good. E stays E, which is good. If it turns to A, that could mean some consolidation. I'm also going to now have you just whisper the phrase 99 again as I place the stethoscope down. Good. I'm unable to hear a clear sound, which is good. If it becomes clear, that means that we could have some consolidation. I'm going to do diaphragmatic excursion, which is me just assessing your diaphragm. So if you could take a deep breath in and hold it. I'm going to percuss your back until I get a dull sound, which is right about here. Now I'm going to have you take a deep breath out and hold it. I'm just marking the area with your shirt. Right, and now we're gonna measure. Normally it should be about 3 to 5 centimeters. Yours is actually perfectly at a 3. Sometimes on well-conditioned person you get 7 to 8. Looks good. Last thing I'm gonna do is just the Snellen chart. It's the last eye test. I'm just gonna point to some letters and just repeat them out loud to me.
H, L, Y, F, S, L.